So this is ankle ENA, so we're going to go through all of the processes that we've done so far. One of the key things when I'm showing all of these, I'm going to show you on whichever side will best suit the camera. Please bear in mind that you would always be looking at the uninjured side, then comparing that with the injured side, and wherever possible also doing bilateral movements such as you can do in the ankle. Okay? So we're going to start off with the active movements first of all. We're going to be doing plantar flexion and dorsiflexion, so we get the leg nice and aligned. So what I'd like you to do for me is take your foot down towards the floor, and then all the way up towards you, and all the way back down to the floor. That's it, and then relax, and obviously we'll then compare that to the other side. Next up is inversion and eversion of the subtalar joints. That's in neutral, okay, so subtalar underneath the talus. You just pull your foot up towards you, so we want this kind of 90-degree angle as you would if you were standing. What I'd like you to do is turn the inside of your foot in towards the middle, and then take it all the way out to the other side, and all the way back in. Okay, and then relax. Next up, we want to do the mid-tarsal joint. So for the mid-tarsal, so we're talking here, where we want the focus to be. We want the foot in a relaxed state. So it's in slight plantar flexion, not forced plantar flexion, just a relaxed plantar flexion. And then we're going to ask them to take the inside of their foot again in towards the inside, and then out as far as we can go, and then all the way in as far as we can go, and relax. Okay, next up we're going to look at the movements of the big toe and then the little toes. So first of all, with your little toe, what I'd like you to do is to curl this big toe like you would with your thumb, curling it down like that, like to curl your big toe towards the ground as far as you can, and then pull it up towards you as far as you can, and all the way back down to the ground as far as you can, and relax. Okay, this time with all the rest of your toes, I want you to so imagine almost like your hand would, where you would curl your fingers around. I want you to curl your toes to the ground, and then pull them all the way back up, and then curl them back down. Okay, that's great, nice and relaxed. Next up is passive, where we're going to do the movements for them. So first of all, we're going to go through plantar flexion and dorsiflexion. Okay, so from here what we're going to do, a couple of handling methods that we can use, depending upon your strength and power, and also depending upon how much you want to really push into the overpressure of dorsiflexion. We can go from here, so we're looking to grip onto the lateral and medial malleolus to stabilise the tib and fib, and then we're going to hold on very, very close to the joint line here with the rest of our hand, and applying the pressure across the top of the foot here, not applying the pressure down at the distal end. Okay, so from here we're going to apply down into plantar flexion, and then pull it up into dorsiflexion, and back down into plantar flexion. Okay, there's an alternative method, especially if you want to really get a decent high strength dorsiflexion movement. You can do it plantar flexion from here, bring it up part way, hand round underneath, and then apply your dorsiflexion in here, where you've got a lot better leverage, back to the midway point, back over the top, and then down into plantar flexion. Okay, it would partly depend upon the type of injury you were feeling for as to which technique you would do, and also your preference in terms of if you really don't feel strong coming up into dorsiflexion here, then just automatically go for this method. Okay. Next up is inversion and eversion of the subtalar joint. So coming from underneath, we're going to hold on to the calcaneum here. We're going to stabilise. Lateral side we're holding on to the lateral malleolus. Medial side we're just distal to the medial malleolus, so we're on the talus, so that talus is fixed. We're going to put this foot into a neutral position, so not dorsiflex or plantar flex, just neutral stance. And then from here we're going to take this, holding on to this lateral border, we're going to pull it inwards into inversion, and then take it out into eversion, and back into inversion. Okay, and then relax. Next up is the mid-tarsal joints. Now our handling changes slightly, so now we're going to hold on, again same positioning with this hand, but the distal hand is going to come further down, more holding on to the foot, so that we get the movement here in the mid-tarsal. So we're going to come round into inversion, back out into eversion, and back into inversion. So you can see it goes further because we're allowing more movement to occur across the rest of these joints. Okay, flexion extension of the hallux now passively. So we're going to try and control this whole toe. We also want to not just focus on the movement here, but throughout the different joints within the toes. So the distal and proximal interphalangeal joints, as well as the metatarsophalangeal joints. Okay, so with the toe here, just nice and relaxed for me, we're just going to take it down into flexion, back up into extension, and back down into flexion. Same thing with these toes. We're going to try and take them down and round into flexion. So trying to flex all of the joints, and then come back up into extension and back down into flexion. Okay. Okay, next up is the muscle tests. So we're going to move on to the tibialis anterior. So we're going to swap sides now because it will just be slightly easier to show you. So we're going to stand on this outer side. So tibialis anterior dorsiflexes and inverts. Okay, so you can see it coming across onto this medial side. So I therefore need to push downwards and outwards whilst your patient pulls their foot upwards and inwards. So you can take your foot towards you and inside. I'm going to resist against you. What I like to do is just match my force. Don't try and overpower me. Just match the resistance that I apply, and I'll build that force up gradually. It's important you give that clear instruction. I'm not going to keep doing that throughout all of these tests, but try to give that clear instruction about how you want them to do it. Okay, so just start to resist for me. That's it, perfect. Keep it going, keep it going, keep it going, and relax. Okay. Next up is extensor hallucis longus, so extensor of the hallux or the big toe. So what I'd like you to do is try and pull your toe up towards you. I'm going to pull your toe down towards the ground and just going to hold it in that position. Okay, so just like to start to resist for me. That's it, keep it there, keep it there, keep it there, and relax. Next up, we're going to do the rest of these toes here. So again, just coming over the top there, so kind of use your hand to grip them a little bit so you've got a little bit more of a purchase on them. Again, you're going to pull your toes up towards you. I'm going to push down and just start to resist for me. Just resist, 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 and relax. Okay, next up is the lateral compartment, so the peroneus longus and brevis. So we're down this side now. So what we're going to want the foot to do is just be in a bit more of a neutral position, and it's going to try and take itself outwards into eversion. You're going to try and pull the foot therefore inwards into inversion. So again, stabilising here, hand and forearm around the outside, and just watch out that you don't flick over in this region here. It can kind of go across your tendons. Okay, so try and make sure you're in a good position to be able to offer stability. I'll show you another handling position for this as well. Okay, so you can use your forearm if you like. This is one position. What I'd like you to do is just take your foot out towards the outside there. Okay, just start to resist and resist, resist, resist. Okay, and we can see the peroneals coming up here. Another method would be just to put your hand on the top here again, as we did before. The issue with this is you're only as strong as essentially your fingers. So again, just try and take your foot outwards for me. So you're only as strong as your fingers and hand will allow you to be to resist, but you have a little bit more control of their foot. So just see which one you prefer there, here or here. Okay, next up is tibialis posterior. So again, we're into the posterior compartment now. So tibialis posterior is a plantar flexor and an inverter. Okay, so we're going to swap onto the other side. Okay, so here we have the foot that's going to try and go downwards and inwards, and we're therefore going to pull up and outwards. Okay, so you can bring your other hand in two ways again. You can either try and hold here. I find this one particularly difficult to try and do, but you can try and pull outwards as well as then pushing down. What I tend to find is their foot just rubs past your forearm, so I don't find that particularly good for me. Again, you can either try and use your hand this way, so they're going to try and pull their foot down and in, but again it's reliant on your hand grip strength. Mine is pretty good, so I'm fairly good at doing it this way. So I'll just show that one to you, so just take your foot down and inwards. And I'm going to try and pull up and out, so I can kind of use my grip strength there to try and help me, but that is very difficult. Or another way of doing it is holding onto the calcaneum here, and this hand comes underneath, so then you've got both bases covered. You all try and do that and that, so you've got two hands covering both areas, and you've got a nice stable support on the ankle there. Okay, so you're going to take your foot down and in, and I'm just going to try and resist it for you. Okay, just start to bring it down and in, keep going, keep going, keep going, and relax. And I definitely feel I can overpower, whereas that way I don't feel quite as strong. Okay. Okay, next up is flexor hallucis longus. So the flexor of the big toe here, coming all the way up into the posterior compartment. So what I like to do is try and curl your toe down into the ground, and I'm going to try and pull your foot, your toe, sorry, up towards you. Okay, so just start to pull your big toe down towards the ground. Keep going, go on, keep going, and relax. Okay, just offering a little bit of support in here. Same thing with the rest of the toes. They're going to try and curl down into the floor, and we're just going to hold and resist you coming up. Okay, so I'm going to pull up, keep going, and relax. Okay, last two is gastrocnemius and soleus, so they need to be over on their front. Just move up slightly. So for gastrocnemius, your hand against your thigh and supporting onto their foot. So then you've got control of their legs, so they're not going to do that and come off either side. Yeah, where it can sort of flick off because of the amount of force that you're producing. So you've got some control, and also you can feel how much pressure they're pressing against your hand. A little bit more gauge in there. With your other hand, you can either, if possible, feel, if they say that it does hurt, then you can feel for where that pain is. You may be able to identify the problem. Or if you find that they're particularly strong, then you may need to hold onto the bed just to brace yourself. Okay? They also may need to hold onto the bed to brace because of the amount of force they're going to apply to you. Okay, so if you just start to push your foot down towards me, so just you can see the amount of force we're producing, we can then palpate and keep going. If I need to, I can add some more. Keep going, and relax. Okay. Last one is soleus. Just roll yourself down just slightly. I'm only moving Neil down here just so you can see in the camera. You would normally keep them further up the bed. We just bend the knee up here. So we're taking out gastrocnemius by putting them in this position. We need to get ourselves into a good position where we can essentially lean our body weight down against this part of the foot whilst they try and push up into here. So you need to be at a vantage point where you can lean on it. So it's no good standing back here and thinking you're going to be strong, because you won't be. Okay, so get yourself right in on top there. So you're going to take your foot up towards, essentially towards the ceiling. Okay, and just start to resist, keep going, and relax. Okay. All right, you can turn over onto your back. The last one now is our palpation. So we're going to start with the medial and lateral malleoli. So we come on to our medial first of all. So we're going to follow the tibia. So the medial malleolus is at the distal end of the tibia. The tibia we know is at the front and slightly medial part, which essentially is in the shin here. So if we come from here and palpate our way down, on this front part we will then come to was essentially like a ball at the end of this stick. So as we come down there, we'll then find that medial malleolus which sticks out just in there. All of that, when you're identifying, is the medial malleolus. Okay. For the lateral, same thing, but this now is at the distal end of the fibula. So we've got the fibula and the line there of the perineals that we can trace down and feel we should be in soft tissue, and then the fibula starts to feel like it comes to the surface. There it is, nice and clear. We come down, and then again we come to this slightly smaller ball at the end, distal end of the bone. Okay, so all of that is the lateral malleolus. Okay, next up is the anterior border of the tibia to the tibial tuberosity. So we know that that comes from the medial malleolus, we know how to find that. So then from there, we can now palpate right the way up the front of the shin. And you need to feel as much as you can of this shin. Don't rush your way through. And you should also be feeling for, sort of, especially in things like football, where they might have some ridges on the front. It might almost feel like a serrated knife, where it sort of goes, bumps up and down, where they've had some trauma to the front of the shin. Okay, so we can come all the way up here till we get to the very top, where again it just sticks out slightly, and that point there is the tibial tuberosity, which is just underneath the patella and the patella tendon. Okay, so just here is our tibial tuberosity. Okay, talocrural joint line. We're going to feel for the lateral malleolus, the medial malleolus. We know that they stick down a different amount on each side. So the lateral malleolus comes down further than the medial. So on the lateral side we can't feel talus, whereas on the medial side we can. So on the lateral side we're going to come up around about 2 centimetres from the distal tip, remember, don't feel the outside and come up because you'll miss it. From the distal tip you come up about 2 centimetres, medial distal tip you come up about 1 centimetre, and then come across. And it's very generic, that, so you need to then feel where that comes together. Feel inside there. You should feel you're at the end of the tibia, okay? And then bring the ankle up into dorsiflexion and plantar flexion to feel if you are kind of at the fulcrum of movement where that joint is, okay? If you think you're not, well, just move slightly distally and try again. Okay, and if you start moving with it, which I'm starting to now, then I know that I've gone too far. Yeah, so I come back up to where I was, right at the point where the joint line is. Okay, so that then is the joint point there, and the joint line is effectively from those two. Okay. Okay, next up is the medial tubercle of the calcaneus. So the calcaneus is our heel bone in essence, okay, it sits underneath the talus. For the medial tubercle, which essentially is the sticking out part of this medial portion, we're going to come from this soft tissue area here on the medial border of the foot. Okay, so coming all the way down here, should be nice and soft, and then we get to a harder bone landmark there, and that then is our medial tubercle of the calcaneus. Okay, you can then also feel right the way around all of this calcaneum here, right the way around to the lateral side, feeling all the way from medial to lateral. Okay, because this is all calcaneum here. Next up is the sustentaculum tali. So that's essentially a shelf that the talus then sits on top of. We know we can feel the talus on this medial side, so that's how you can remember then sustentaculum tali is on that side. So we come from the medial malleolus, distal tip, then just underneath there, that is the talus. Come down a little bit further and have a feel, and you'll feel there's just like a little ridge that sticks out just in here. There's a ridge sticking out, and that is the sustentaculum tali, where the talus is then sitting on top of it. Okay. Next up is the tuberosity of the navicular. From the sustentaculum tali, if we come forwards relative to the sole of the foot, so you can see that we go that way, we just follow that forwards until we come again to another landmark where the bone is sticking out. That there is the medial tuberosity of navicular, navicular being here. So it's the medial edge. Okay. Cuboid is on the lateral side. So for cuboid, we also need to go along with one of the next portions that you're going to need to find, which is the base of the fifth metatarsal. So base of the fifth metatarsal, we just run along this lateral edge. Okay, so we have sort of a slightly softer part, and then what happens is it dips outwards, out to the side. That is the base of the fifth metatarsal, so we've got a bony landmark sticking out. From there, if you just drop off it and then come up the side of the foot, that flattened surface is the cuboid. Okay, so this is the cuboid on the lateral side just here. Okay, it's essentially behind those bones. We've already found the base of the fifth metatarsal, as we've just said. Next up is the shafts of the metatarsals and then the heads. So we've got the base this end, the head this end, and the shaft is in between the two. So from there, from the base of the fifth, we can run along the shaft, and then we're going to find the head. Now it's quite important you're also fitting from underneath as well as on top, but you will get the most out of this feeling of the bone on the top, because this is essentially just skin and a few tendons, whereas underneath it's much thicker tissue. So therefore, if we go from here, we can feel all the way along, feeling the shaft right the way through to the head of the fifth. Then we can move along to the fourth, and again you can reverse it, so it's probably slightly easier for you to palpate from the head, shaft, and then bases of 4, 3, 2 and 1. So there's the head, and I palpate along until you get to just at the very end there, where we then drop into the joint, and that's then back onto the base. Then come onto the head again, work your way along, etc., all the way along down to the first. Okay, next up is the deltoid ligament. So we have the medial side for the deltoid ligament. Quite a thick ligament here. It's very, very strong, remember, on this medial side. It's the lateral side that tends to be more of our injured area. And it's deltoid because it's deltoideus in shape, which is this triangular type shape here. So we have an anterior portion running anteriorly and inferiorly. Then we have a transverse that comes across here. And then posteriorly we have another, essentially the posterior edge of this triangle. So it's from this posterior medial malleolus down and posteriorly, the transverse band across there, and then the anterior band at the front. Okay, coming anterior and inferiorly. For the lateral side, we then have at the very at the distal end again, lateral malleolus at the front, the ATFL, the anterior talofibular ligament. So from the very, very front, so this is the malleolus here. We are right at the very front edge, and it's quite short, and it's just in there. Most people think it comes down here, it doesn't. It's right at the very front. That is our ATFL onto the talus, the talus being just in there. Next up is the CFL. And again, also, when we're trying to feel for that, if you want to, you can put it on a stress to take it into plantar flexion and inversion. It can just make it slightly more exposed, and also because the ligament is then on a stress, slightly easier to find pain and problems with it. For CFL, so this is just now straight down from the lateral malleolus down onto the calcaneum. So again, we're just going to feel down that line at the distal tip. That's where the CFL is. If we go front to back, sometimes you can feel almost like it feels like a little rubber band underneath. And again, we can put it on a stress, just taking it into inversion. Pure inversion, then we can feel a little bit of CFL. And then last of all, PTFL, so again running posteriorly, very much like ATFL, it's almost completely anterior. This one is almost completely posterior in its orientation. So right in the very, very back, and that one we bring it up into dorsiflexion and inversion, and then feel for the PTFL in the back. Okay, next up is for the syndesmosis joints, so the AITFL, anterior inferior tibiofibular ligament. So where we're essentially joining the tibia and the fibula, because they are two separate bones that need to be joined together. And it's inferior because it's at this end. So what we have there is just superior, therefore, to the talocrural joint, just in there. And you want to come at it from the lateral side is the AITFL. You just see Neil there twitching because this is one of his key areas of pain sometimes. Okay, so right in the very front, just there. The posterior version, so same thing but posteriorly, so therefore back in around the back, again just up that little bit higher. Okay, so PTFL was here, we're higher up into the ligament, and that's just in there. Last of all, the syndesmosis. So now from that point you're then going to feel along the joint between the talus and the fibula in the very anterior surface. You're going to come up about a quarter or a third of the shin, and you're just going to palpate in that joint line, feeling for any pain or discomfort right in there. Okay, that's it. That's all of the tests.